You're listening to Health Professional Radio. My name is Wayne Buckler, and today my guest is Errol Lim, Managing Director of BJC Health. BJC Health is the Bone and Joint Clinic. Errol, welcome to Health Professional Radio.
Yeah, no, thank you very much, Wayne. Lovely to be here.
Now, Errol, just so that we can narrow you down geographically, so as to speak, you're a Sydney-based clinic?
Yes, that's correct. We've got 3 clinics in Sydney, one on the North Shore, one out west in Parramatta, and another in Brookvale. So we're quite fairly spread out, but we hit a few corners of Sydney.
Now, I understand that you target musculoskeletal disease. Why is the Bone and Joint Clinic different to your run-of-the-mill specialist in these areas?
Yeah, so musculoskeletal is our specialty, but specifically more is that it's anything arthritic. We have 7 rheumatologists working at BJC around the 3 clinics, and so we're close to, I think, being one of the biggest sort of rheumatology clinics in New South Wales. And so we pretty much have to know everything arthritis or inflammatory in disease. So that's our, I guess, you could say, our USP. Mm-hmm. And that's what we hope to be known for.
And inflammation and inflammatory diseases is one of those sort of categories of the tsunami of chronic disease we keep hearing about.
Yes, definitely.
What's your experience with that? Is it a common and growing problem?
It is. So firstly, in terms of musculoskeletal disease as a whole, back in 2010, the World Health Organization pointed out that musculoskeletal disease is the greatest burden on disease. It took over cancer as a whole. And of that, osteoarthritis makes a huge percentage of MSK, and also low back pain. And where inflammatory disease comes into play is that osteoarthritis is very much something that the rheumatologists see a lot. And when it comes to back pain, inflammatory back pain is actually a decent amount of back pain, anywhere up to 5%. And unfortunately, a lot of these patients with inflammatory disease are misdiagnosed by various practitioners, and only because it's so difficult to diagnose. And something like ankylosing spondylitis has a diagnosis rate up to 10 years in this country. And so we feel that is something that health practitioners need to be educated about, and of course the general public. And so we feel that creating clinics such as ours, where we concentrate on these inflammatory diseases, are important only because they don't really exist.
That's an interesting way of putting it, because they don't really exist. I understand entirely what you mean.
Yeah.
My guest today is Errol Lim, Director of the Bone and Joint Clinic, and we've been talking about what makes them a little different. Now, Errol, you promote connected care heavily. Explain that concept to us.
Yes. We started on this journey a good 10 to 12 years ago, and we feel that healthcare generally requires an integrated service. So there's not one practitioner that can really, in a sense, fix a patient. You'll be lucky if that happens. And as you well know, in many industries, but definitely in healthcare, it requires a whole team approach. And so trying to put this team together has been very challenging and difficult at times. And so we've coined this term connected care, where we feel that everyone needs to be on the same page. Everyone working together needs to like each other and have confidence in each other, so that we actually get the best patient outcomes that we can. Mm-hmm. And the challenge really is, getting health professionals to talk to each other and work with each other is not the easiest thing, and I'm sure you've heard that before in the past.
This is true. It is an extraordinary industry, the health industry. It's one of those industries that hasn't gone through the great industrial reconstructions of the 1960s. And so it is in some ways still very fragmented and disconnected. And in other ways, of course, it's very homogenous and similar. So it's an interesting industry. One day someone will write a PhD about it or something, I imagine.
Yeah, definitely. And the words you use, fragmented, you can chuck in siloed. You must hear that all the time in the public hospital system, let alone when clinicians go out in private practice and in a sense, want to earn money and have the pressures of business. then trying to work together and putting extra time into developing relationships so that we can foster greater patient care is just an added pressure.
Yes, and it is extraordinary how in my work I find that siloing to be dramatic in hospitals. So one floor of a hospital will have very little insight into what's happening on the floor above or below them. It's really quite surprising.
Yeah, no. And, that same thing will occur in primary care and in the private system. We spend a lot of time on internal communication. And even then, it keeps coming up as an agenda items. How can we improve communication between our practitioners, our administrative and reception staff, so that everyone's on the same page? And that requires good systems and processes in place. And we're 45 people strong in our organisation, but even then, we have the same issues as anywhere else. We just kind of feel, because we get no funding whatsoever, that and everything we generate is just through patient billings, but we have to spend a lot more into trying to create this integrated culture.
I can believe that. 45 is a big clinic.
Yeah, it's spread out over the 3 locations, but yes, we're growing, but we've also halted our growth in order to try to make sure our quality of care is kept up to high standards and we measure patient outcomes and so forth. But it's difficult to do without any public funding.
Now, Errol, what is the takeaway message for clinicians in the acute care sector, because most of our listeners are in hospital settings? What's the message you'd like them to hear from you today?
Really, I think that both public and private sectors have to work together. I think programs already exist, and I've been involved with some programs in New South Wales, where successful programs that were developed in the public system are being trialled in the public and private system. Because, as we all know, governments don't have, bucket loads of money, and there's less and less money going into health. And so the public hospital system can't really cope. And so we need to utilise resources in the private sector, and there are many practitioners out in the private sector that at times don't have enough work. And so if we can develop programs or ways to work together, I think we can go somewhat of a way to helping the issues that we have in health at the moment. My guest today on Health Professional Radio is Errol Lim, the Director with the Bone and Joint Clinic in Sydney, Australia. Errol, my favourite question of every interview: in every industry there are misconceptions. What are the biggest misconceptions amongst your colleagues, clients and patients that drive you nuts and keep you awake at night? If I can start with potentially my colleagues and some people say I'm a little bit unfair with doctors and in fact medical specialists, but they come from a traditional form of education back in the hospital system. I can hear your chuckle. And so they were practicing medicine in a way that their bosses and their bosses before them practiced. And unfortunately, in a changing marketplace where customer expectations are so much higher, and the need for relationship building is essential in selling a service, because we are, in a sense, selling a service. Yes. Whenever they start working in BJC, it's trying to break down that traditional mold of thinking, and trying to put the customer essentially first all the time, where that patient journey or customer experience is key to getting a patient better. It's not just the medication or the clinical diagnosis or going for investigations that's key. It's how you actually treat that whole patient as a whole. So that's one issue. From a patient viewpoint, having been in this arthritis space for a while, it's really probably what they read online or the education that they get about a particular disease state. Especially since I've already mentioned that with some diseases it takes so many years before people get the right diagnosis, 10 years or so. That's frustrating, because we have drugs and management now that can help deliver great outcomes for people with ankylosing spondylitis, rheumatoid arthritis, and a gamut of other arthritic conditions. And a big one for the doctors is gout. Gout's still, in a sense, very, very poorly treated or poorly managed, very often because of patient attitudes towards it. Those are our frustrations. We can help, but we just need to put people in the right place to receive the right education.
Well, maybe we can help a little bit with that today. Thank you for your time, Errol. It's been a pleasure chatting with you.
Pleasure, Wayne. Thank you very much.
Now, people can get hold of you on your website at bjchealth.com.au. Is that the best way?
Yes, that's correct. That's fine, and they can fill out a form or, just shoot through an email.
I'll mention that again because I'm always getting in trouble for saying websites too quickly. The website for the Bone and Joint Clinic is www.bjchealth.com.au. And if you've just missed our interview, the good news is we have a transcript of it on our website and also a SoundCloud archive, and you can hear it on YouTube as well at www.hpr.fm. My name is Wayne Buckler. This is Health Professional Radio.